everyone. Let's try in English. So I live in Denmark, and as you can see, I am used to having talks in Danish in Denmark, but let's try in English. So, my name is Susanna Søberg, and I'm a scientist in metabolism. I have researched metabolism for more than a decade. Actually, I've done that my whole life. It started out, just a personal story here from the beginning. My mom was diagnosed with type 2 diabetes when I was about 12 years old. And that was quite a huge shock for me, but that was the first time where I realized that dying is not just something that you see in movies. I realized that this is actually something that could affect my closest and most loving family ever. So, at 12 years old, she was diagnosed, and I was like, Mom, we have to do something about this. And I read in books that you can do some kind of lifestyle changes to reverse it. And already at that time, I started opening these books, and within 6 months, me and my mom had made a schedule for her to reverse her type 2 diabetes. She was on metformin medicine for only these 6 months, and after 6 months, she was out of the medication, and now more than 30 years later, she has never been on medication since. She cured herself, she doesn't have type 2 diabetes, and that's what her doctor says. She gets regular checkups, but she doesn't have type 2 diabetes anymore. So when I was about 12, 13 years old, I realized that lifestyle diseases are reversible. We just need to know how. So I kept studying this, and ever since, I have not stopped researching this. Today, I am 42 years old, and I still research metabolism, and I try to tell people that this is something that we can do something about with lifestyle changes, and that is what I've been researching here in Copenhagen at the university. I'm on a mission still, since my mom got sick, and she is not sick today, but we still keep an eye on her. We're still on this mission to help people reverse this disease or prevent disease. So I think it's overrated when we talk about medicine as only, you can say, the only reason or the only cure for lifestyle diseases. People need to know how to reverse it, and how can we do that? Well, actually, I think we should start looking at the problem. Oh, there it is. So, right from the morning, some hardcore facts. I know it's a little bit harsh, but chronic stress is the leading cause of all the lifestyle diseases that we see worldwide. When I was a nurse working at the hospital, I realized something heartbreaking, and that was that people get admitted to the hospital with lifestyle diseases that could have been prevented if only they had known what to do. And for more than 5 years, I struggled to really be in this role where I met people when they were already sick. So that really gave me the, you can say, courage to also keep studying what is it that reverses disease and what is actually the root cause of it. And the more that I studied, the more that I want to actually do science behind it. So as a nurse, I started doing research at the hospital. And we collected some data, and we found out that people actually really don't know what to do before they get ill. So, long story short, I went back to the university, took a master's degree in health science, and after that a PhD in metabolism to figure out how do we keep ourselves healthy. How do we actually do that? If only people knew that, they could reverse what might actually turn out to be lifestyle diseases later on. So I think about my patients when I was in the hospital, those who got amputated right here, and some up here. Some here, and some got operations in the heart, and some of them we lost. And I've been there. I've lost many of the patients that we tried to help, but it was so hard to realize that if only we had met these people 20 years ago, we could have told them what to do, because there was no really reason why they were in this situation anymore and why these family members had to suffer. So I have looked into the data of many years of research, not my own, but collectively, these are some of the hardcore numbers from the World Health Organization, and I've done some calculation also just to see how is it that the root cause of all these lifestyle diseases have not been transmitted out to people and told them, hey, you know what? The reason why you get a high blood pressure, the reason why you get type 2 diabetes is because of your lifestyle. It's because you have to reduce the root cause of it, which is stress. Chronic stress. It's not stress in a good sense, because there is also the good stress, and that we will come back to that, but there is also the chronic stress. So of course I'm talking about chronic stress when I talk about why we get sick. So if you take, for example, high blood pressure. A high blood pressure, that leads to inflammation. Inflammation in the body can lead to heart disease, which can lead to death, okay? And you can read the rest of them, but they are all the major killers in the world, and the root cause of them is chronic stress. So my mission, So my mission is still to help people reverse it, reverse the chronic stress. I want to help 1% of the world, over 80 million people, to reduce stress and cortisol levels by 20 to 25%. Why do I say that? That is because I have measured how much cortisol can be reduced with what I call contrast therapy. Contrast therapy is what I've been researched in my PhD. My PhD was twice as long as the others because it was so hard to get the funding for something for just prevention. So it took me almost 7 years to do my PhD, not because I'm slow, I want to say that, just because it took a lot of time to collect all the funding to do these huge studies. I'm going to tell you about these studies just in a second. But what we found out was that if you do contrast therapy, we can reduce cortisol levels by 20 to 25% within 3 months of practicing this. What do you think this will affect lifestyle diseases? Just 3 months of contrast therapy. Do you think it will have an impact on lifestyle diseases? Okay, so we need to talk about this because I cannot hear you. So you need to scream a big yes if you can feel or you can see what I mean, or at least just nod. Do you understand what I'm saying about the 25%? Yeah. Probably we don't have to shout, but I did hear you. Thank you for that energy. And I would just want to say that this has been my mission ever since I got finished with my PhD in 2021. The research that I did is in the middle. Let's start in the middle. Winter swimming and sauna. It really became my passion once I found out what it could. But I started out asking myself, what is it that reverses the stress in our bodies? What can we do? Physical activity, I knew that one, so I didn't want to go into that space. So I asked my mentors, what else can we do? And they mentioned something very, very mystic and something I didn't know anything about, something called the brown fat. Brown fat is our healthy fat in our bodies. It is the opposite of the white fat. So white fat is what clings onto your body and you want to get rid of that, right? You have it on the belly, on the thighs, you want to get rid of it. And we have too much of it. Then we have the brown fat. It is located under your clavicular bones, and it's activated as soon as you get just a little bit cold on your skin. You don't even have to do a cold plunge, actually. You can go outside in a t-shirt and just get a little bit cold on your skin. You can sleep in a cold room and you will also activate your brown fat. Brown fat, once it's activated, it increases something called noradrenaline. Noradrenaline is the main driver in our brain and in our body to activate our brown fat. It also gives you drive, it gives you energy. So once you plunge into that cold water, you will have a spike in you will have a spike in noradrenaline by up to 2.5, up to 5 times above the baseline. That means you will have a huge increase in activation of your brown fat. So the reason why my mentor said brown fat research, Susanna, we need to know if the brown fat can actually help us reduce the risk of type 2 diabetes, or it can reduce the glucose levels or fat levels in our bloodstream. And I said, well, we don't really have that much research in humans yet. But once I started reading about the brown fat, I saw that the research in rodent studies and also in human studies, which are quite new, it's only from the millennium and up until today, so 25 years of research, that really proves that once you get cold, you activate the brown fat, and for that, it needs to have fuel from the body to keep that heat up. So the main reason that we have brown fat is to generate heat in the body. So when you get cold, brown fat is activated to generate heat in the body so you don't freeze to death, okay? Simple as that. But it needs fuel. It needs glucose and fat from the bloodstream. And it takes that up in the brown fat and uses that as fuel to generate the heat in the body. So imagine this. You are going outside, out on the jetty. You want to get into that cold water. As soon as you just undress a little bit, the brown fat will already be activated. And it's going to take up that glucose and fat from the bloodstream. And in that sense, it reduces the glucose and fat in your blood. That is how we clear it out. That is how we clear it from the bloodstream. And that is why we have seen studies showing that people with pre-diabetes and type 2 diabetes and people without it can actually reduce the levels of glucose in their bloodstream just by getting cold. We have also seen studies showing that even sleeping in a cold room at 19 degrees Celsius for 1 month can actually increase the insulin sensitivity in the body, which means you are further away from getting type 2 diabetes. So the whole focus of what I have been doing and what I'm doing now is really to help people see how we can reduce lifestyle diseases by doing something active, something non-invasive, by an activity as going into the cold water. Just like exercise, this is increasing your stress level just a little bit, but just on the healthy side, right? So there is the healthy acute stress, which repairs the cells on the inside. So I'm just going to tell you what happens on the cell level now, because you need to know. So when we get into that cold water, you activate the heat shock proteins in the cells. These will repair the enzymes, the proteins that you can repair. And if they're not repairable, then the cell is going to get rid of them very quickly. And in that sense, the cells are repairing itself, getting stronger for next time, and that is called adaptation. So you want to get adapted to the cold as well, because as soon as you get adapted, you would have that stronger cells, stronger immune system, because it's prepared for the stress that is coming in your life. So that's only on the physical level. What happens on the mental level? Some of it is up here, as you can see, some of the results from other studies, not only my research, but other studies as well. But what happens is that once you open that window for stress, acute stress in your body, lowering the glucose level, lowering the inflammation in the body, that will also help on your mental health. We know depression and anxiety are actually metabolic diseases. So once you can reduce the inflammation in the body, you reduce the risk of mental diseases as dementia, anxiety, and depression, okay? And this has already been shown in longitudinal studies where you have looked at how much inflammation do people have in the body and how is that correlated with mental diseases as depression and dementia. Alzheimer's diseases, which we are all trying to figure out today, how can we cure it? But we already know you have to lower the inflammation in the body, and we know how to do that. Physical activity, cold exposure, heat exposure does the same. So once you combine these things, you have a super cure for lowering those, you can say, background noise that in the end will turn out to be lifestyle diseases. So what we see here in my research is that once you activate the brown fat, you will have a lower glucose level, you will have a lower fatty acids in your bloodstream, you will have a lower blood pressure. And we did see that after one winter swimming season, that people could actually lower their blood pressure. So underrated, that blood pressure. Have you had your blood pressure ever measured? Good. And those who didn't raise their hands, go and do it. Find out if you have a high blood pressure, because blood pressure is such a good measure for a status of your body. If your blood pressure is high, you need to do something about it. It shows you have inflammation in the body. These simple tools, don't overthink them. You should just do them. The body will do the rest. It will lower the inflammation in the body, lower that blood pressure, and that will reduce your risk of all these lifestyle diseases. Once you open that window for stress in your body, you will open it in your mind as well. So you might have heard, either me saying that or someone else maybe, that once you have opened that window for stress, going into stress, physical activity, cold exposure or heat exposure, you will open that window for how much stress you can cope with in your life. And that is because this is the pathway I'm talking about now. So if you have taken a cold plunge, you show your body and your mind that you can cope and overcome that stressful event. And once you do that again, you show your body and your mind that this is something that is going to happen again. Just be ready. It's going to happen again. And that means that your body will actually get ready for the next time. So on the pathway of noradrenaline, we have also the pain pathway. So you've probably heard about endorphins, right? Endorphins are our body's own morphine. But when you get into cold, you actually activate noradrenaline, which is actually our pain pathway once you get into the cold. So if you have joint pain or you have a back pain or something and you have tried to take a cold plunge and you thought, hey, why is this reducing my pain? That is because you are increasing noradrenaline. Noradrenaline is the pain pathway along with endorphin in the body. So not only does the noradrenaline actually activate the brown fat, but also it widens that window for how much stress, how much pain you can tolerate in your life. Stress and pain pathway is correlated. So when you work on your pain pathway, you actually train how much stress you can cope with. So the physical pathway of pain, you can say, is correlated with how much pain or stress you can tolerate in your life. So that is how you can train how much stress you can tolerate, okay? I hope it makes sense in that way. Yes. I want to ask you, how many of you are winter swimmers? Ooh, that is like the whole club is here. I love it. I love it. I'm also in a club. Actually, I'm in 3 clubs. And I just love getting around to all these clubs and just seeing how people do it and how they feel about it. The whys of how people do it is like 100. Some people do it because of pain. Some do it because of loss, grief. Some do it because it just makes them feel happier. Some do it because it's fun to do with their friends. The whys are just so many. That is why when people ask me, why do we have to do this? It's so multiplied, it's so wide in a window for, why not do it actually? And that leads me into the next subject I want to talk about, because some people say, well, so is this something that's going to make me live longer? Longevity. Well, I cannot promise you that, but do write me when you are 100 years old. If I succeeded, that I do want to take the credit, just a little bit. Just write me a note and say, hey, I actually did that, and it helped. No, I'm just kidding. I just want to say that, of course, this is something that will help you on your stress level. It will reduce your chronic stress, and that's going to help you live longer, of course, because this is the root cause of all the lifestyle diseases. So at least you can reduce the risk of all the diseases that I saw before. But I don't think that this is the main reason why you should do this. Contrast therapy is something about living in the now. If you live in the now, you get happier. When you get happier, you also will live longer. So maybe the reason why you should do this is because it gives you an effect right here, right now, and maybe that is actually the reason why you should do it. If it reduces stress in your life right now, it will have an effect on the long term. But don't think so far ahead. Don't be out there. Be here. Be now. So if you want to take something from this talk today with you home, is just do it because it does something from you today. If it's going to do something for you later on in your life, it probably will, and your whys are going to change all the time. You might do it for fun today. You might do it because you just met a friend who is going to do it tomorrow. But later on, you might do it because it reduces your pain in your body. Your whys in your life are going to change. So if there's something that I would like for you to go home and think about is, how can I make myself a better life just today? How do I get just happier now? Because that's gonna have an effect later in your life, and it's gonna make you live longer, just in general. So do things that makes you happier. I mean, if drinking a soda is going to make you happy every day, then maybe swap that one out, because there is also studies showing that that is definitely going to increase your blood sugar levels. So I don't mean just live in the now and don't think about anything. I'm just saying that look at the good things that we know have good results, going to lower your cortisol levels, it's going to lower your inflammation in your body, but don't think too far ahead. It's just better to be here right now. I am thinking thank you all of you for showing up. I'm so happy that so many of you came. This is early morning, so I'm just thinking this is the Winter Swimming Club meeting up here in the morning, and I love that. Thank you for that. I would like to hear if anyone has some questions, because often there's a lot that people want to know. Okay, so while he's getting the microphone, I just want to say, from my research, I also came out with like a protocol for how little can you actually get away with. And when I say that, it is because I am not all up for just doing a lot, but the protocol that I came up with was a short acute stress, because that shows good results on your health, okay? So we don't want more chronic stress, we want just a little bit acute stress. 11 minutes of cold water immersion per week, and 57 minutes in total of sauna per week is enough to reduce the blood sugar levels, is enough to lower those blood pressure in your life, and also it will activate your brown fat, get more of that so you can burn some more calories. And that is what we want. So if you divide the 11 minutes of cold exposure on 2 to 3 days per week, then you have a cold plunge on just 1 to 2 minutes per plunge. You don't have to do longer. You don't have to cool your inner organs. Your heart is not going to thank you for it. Your wound is not going to thank you for that. You just have to activate your cold receptors in the skin. And it takes 1 to 2 minutes, done. Over, you can get on with your life. You have a lot to do. So, yeah, questions?
Hi, thank you. Thank you for that really good information.
Oh, just a second. I cannot hear anything. Yes.
Can you hear me?
Yes.
Okay, thank you. I have 2 questions, but it could be related. Number 1, how do you get started? I see it actually scares me to think that I'm going to jump in the freezing cold water, and I see, people, chiseling in the ice and then jumping in there, and it makes me nervous, and it scares me. And number 2, can you get the same with a cold shower? How different is that?
Very good questions. Thank you for that. So how do you get started? And I would just say it's normal to be not just a little bit scared. It's normal to be freaked out. And I'm going to say that I was so freaked out when I started this research, because I was not a winter swimmer when I started my research. So I was like, I'm just going to look into this. I had no intention of becoming one myself. I was just like, in theory, just super interested to see if cold and heat exposure could do some of the same things that exercise could do. So I was just on an academic level very interested in that. So I was the same. I was so scared. It took me a year to just to get the nerves down enough to go out on the jetty and go into the water. What I did as an anxious person, as I was to think a lot about my breath work. I had no guidance. Nobody could tell me how to do this. And when I asked winter swimmers, they did not really have any. They had so many things. There was like everywhere. All the good intentional reasons to do it, but also how to do it was just everywhere. So I started reading, how can I get a control over my nervous system? And that is where I found out that why we should do a short cold plunge and not a long one, and that you should use your breath work to lower that stress level before you get in. So the first thing you should do is, 1, don't go alone. Bring a friend, your neighbor, your mom, your daughter, or whatever, your son, or your husband. I did that. Feel secure in that sense, and it's very important that you do some very deep breath works before you get into the water. So in that sense, you tell your nervous system, this is cold, but I am in control. I am okay, and I can overcome this. The best way to do it is just to take some deep breath. Imagine this is the water before you step. I'm not going to step over here, but imagine this is the water. So you're going to do some deep breathing in through the nose and then out through the mouth. If you can do that for just, the wind was so heavy yesterday. So if the wind is like that, you cannot stand for long. You will have a cold shock just on the jetty. But when before you just step in with your foot, then totally exhale. You have to empty the lungs. And this is from experience, that you can feel almost like you cannot breathe because the respiratory system is going to shock a little bit when you get in if it's the first time. So if you can breathe completely out, just exhale, then you will empty the lungs and you will make room for more, you will have more capacity to have that breathing in the water. Step in slowly. Some go only to the navel, and you don't have to go further than that maybe the first time. If you want to, you can go full in. Don't dunk the head, you don't need to do that, but don't hyperventilate in the water. Don't hold your breath in the water. Just keep a slow breathing if you can. Try and see if you can. And only for 1 minute if you can. Okay.
The second question was from her if a cold shower also works. I know you mentioned it in your book, so maybe a quick answer, so we have one more question here.
Yes, okay. So cold showers work as well, but cold showers don't activate the parasympathetic part of your nervous system just as well as a cold plunge would do. So I would say start in the showers and then go over to a cold plunge. That is my recommendation.
I have one last question here. I'm sorry, is the last one we can have time for?
Hi, I'd like to know if you're already stressed, if you have chronic stress, or if you're actually diagnosable with stress, if it's recommendable to do contrast therapy, or if it's just extra stress adding on.
Good question.
Yeah, I love that question because many people are very, very stressed. And I would say once stress has implemented in the body and it's on the burnout level, then I would say careful. It's just like when you are sick, don't go and exercise hard. You go for a walk. You don't do too much. I would say do something else. I would say a warm bath is actually better for you in that extreme stress burnout level. If you have complete anxiety full on, then that is maybe not what you do as a start. You do something else to lower that stress level a bit, and then you can start doing the cold plunges. So I would say you need to be at a level where you know that you can get a hold of your breath when you are in panic. So it depends on the anxiety level, it depends on the stress level, of course, but you would need to figure that out with yourself, of course, but I would say be a little bit careful about that. I hope that was answer to your questions. And then I just want to say thank you so much, everyone, for coming. I am at booth 21 at Thermalist, and I will be there for 30 minutes if you want to come and have a book. I brought 3 books today, 2 Danish and 1 English. If you want to have a signed book, I'm over there for 30 minutes. Thank you so much for coming.